Hi, everyone. Thank you for joining. My name is Robyn Hoffman. I'm a licensed clinical social worker. I'm excited to be here today to talk about a very important topic, which is care for the caretakers. So today we are going to talk about who caretakers are, some of the different responsibilities and roles caretakers have. We're going to talk about self-care, what that means, why it's important, some of the challenges for prioritizing our self-care. Then we're going to go over some scenarios and examples of how we can implement self-care into our lives. And then we'll go over questions and answers. So today's lecture focuses on caretakers. Caretakers specifically in today's webinar will focus on people who are caring for children and adolescents. This can be parents, guardians, healthcare professionals, and also educators. So what are some of the responsibilities for caretakers? Many of you, I'm sure, have children or are involved in the care of others, and that can include scheduling doctor's appointments, handling the doctor's appointments, at-home care, medication management, homework, reminders, scheduling activities, house maintenance like cleaning, meal prep, cooking, laundry, making the beds, repairs, watering plants, everything, transportation, drop-offs, emotional support, physical support, communication with teachers, doctors, parents of friends, and many, many more. So when I took a step back and I thought of all of the different titles that a caretaker wears, so many different titles came to mind: chef, therapist, expert, fixer, friend, teacher, problem solver, mediator, employee advocate, decision maker, nurse, cleaner, disciplinarian, all these different things all throughout the day that we're juggling, caring for other people, trying to care for ourselves, trying to fulfill our responsibilities as human beings, citizens, employees, parents, wives, sisters, daughters. So, so many different things we're juggling at one time that it brought me to my next slide, which is, how do we make time for you? When you have so much going on in your lives and so many responsibilities, it can be very difficult to at times prioritize time for yourself. So we're going to talk a little bit more about that as we go on throughout the presentation. So what is self-care? Self-care can be anything that helps you maintain your physical, mental, and emotional health. It can take little to no time at all, or it can be things that take much longer. It could be as simple as having a cup of tea, taking a bath, reading a book, going for a run, or it can be bigger priorities like spending time with friends, going out to dinner, prioritizing your hobbies. For families, self-care really helps parents and teams cope with everyday pressures in a more positive and manageable way. So why is this important? Why is it important to take care of ourselves? How will this benefit our lives? So prioritizing your self-care protects your overall well-being. It helps you to manage everyday life stressors. It reminds you of the importance of focusing on yourself and spending time to take care of yourself. It also models the importance of self-care for the people you're caring for, modeling that it's important for me to do what I need to do so that I stay calm and I manage my stress is really an important lesson to model for your children. It reduces anxiety. It increases feelings of happiness. It makes sure that your responses are proportionate and that we're not lashing out disproportionately. It helps preserve your energy, reduces risk of burnout. It promotes your ability to respond to stressful situations and inevitable conflict in a proportionate and appropriate manner. And it also improves your focus, helps you think clearly, decreases impulsivity, increases your patience, and it really helps you to maintain a healthy lifestyle and healthy relationships. So, what are some challenges of self-care? We know why it's important, but why do so many of us find it difficult to prioritize? So, the research looked at this, and many respond that it's because of time. No one has time. And they sometimes say that without realizing that it can just be a few moments. It can be 2 minutes during the day, today being a gorgeous day, to go outside, take a few deep breaths, enjoy the sunlight, get some fresh air. So it's a misconception that it takes so much time because it could really be just a few moments that you're taking for yourself. At times we lack motivation and energy when we're finished fulfilling all of our priorities and all of the needs of, the people we care for. At times it's hard to find the energy to prioritize yourself and to motivate yourself to do the things that you know will result in you feeling good. Sometimes we lack the awareness of how much we really need it. Sometimes we're always putting other people first, maybe more times than not. And at times we feel guilty about spending time or money on ourselves and our care. So what if we don't take care of ourselves? I found that picture and I thought it highlights this well of what happens when we don't spend the time prioritizing our self-care. And I'm going to go into two different scenarios and take a look at some of the complexities in everyone's day-to-day lives and how this can manifest when we don't take the time to make sure that we're taking care of ourselves as well. Maggie is a parent of a sixth grade student, Alex, who is visually impaired. Maggie is Alex's primary caretaker. This is Alex's first year at the middle school. He receives accommodations through his IEP. One of the accommodations is a one-to-one who assists him in the hallway to ensure that he gets to his classes due to his visual impairment. Maggie is also a teacher at the elementary school in the same district as Alex. This year, Maggie had a challenging class with many behavioral issues. This morning, Alex was giving Maggie a hard time and refused to eat his breakfast. Maggie rushed to get Alex to school on time and make sure she also got to work on time. When Maggie got to work, her principal unexpectedly observed her. Maggie's class was misbehaved and she was fearful that she would receive a negative review. When Maggie was leaving work, she saw an email stating that Alex was absent today. Maggie panics as she knows she dropped him off at school. Maggie races to pick up Alex from school and he's observed crying outside. Alex tells Maggie that his one-to-one was absent, so he sat in the bathroom hiding all day because he was scared that he wouldn't find his classes. Maggie was furious to hear this information. She parked her car and entered the school with Alex. She marched into the main office and began shouting about the situation. Alex was observed hiding in his hood, embarrassed by his mother's outburst and the information disclosed in front of his peers. Maggie was then escorted to a private office where she learned that a substitute had been assigned to Alex and was waiting in the guidance center all day, which was the identified plan for when the one-to-one was absent. So I know that's a lot. And I purposely made it a lot because when we have days like that, it all happens at the same time. So what do you think? How do you think Maggie handled the situation? What do you think she could have done differently? Did Maggie's lack of self-care come with consequences? So any thoughts about this example and how it was handled?
I personally feel like, how do I feel like she handled it? Yes, she could have handled it better the way that she reacted in terms of, lashing out and, he's embarrassed in front of his peers. I think she was rightfully upset that, he seemed to be missing from school and then he's had, was in the bathroom all day and missed out on a full day of school. But in this instance, I don't know, like part of me, that's why I was so interested in this topic tonight was because self-care, I feel like the feelings of guilt are the main thing that I tend to feel because it falls on me and then, I'm balancing everything else. And so I feel guilty taking that time away when I feel like other systems, it's really like more of a systems issue a lot of the time that is failing. For instance, with him, the plan was not
Right.
clearly delineated, so it wasn't necessarily her fault, and any self-care probably maybe wouldn't have been, come into play. Maybe she would have been able to keep more calm, but she also had a hectic day herself at work and everything. So, I think it's hard to balance what's in our control and what's not.
It is a difficult situation, and I could imagine any parent getting that message and then hearing the response from your child, your stomach just drops.
Mhm.
So it's hard to manage. When I was thinking about this scenario, I was thinking about some of the early warning signs that maybe Maggie could have noticed that her day was starting to heat up and that her personal thermometer was starting to heat up, starting with
Mhm.
your kid refuses to eat breakfast and you're almost late for school. That's, already starting the morning off stressful. Then you're unexpectedly observed. It didn't go as planned. So all of these things, at what point could she have said, I need to take a break?
Mhm.
Maybe that's asking a colleague to go out for lunch. Maybe that's getting some fresh air, doing something.
Mhm.
And maybe if and maybe not, maybe if she would have taken those steps earlier throughout the day, when she got to her son, maybe the conversation would have been different when she would set up a meeting with the principal or went home, took Alex home, talked with him about what happened, and then set up a meeting with the school or sent an email to learn more about what transpired. Maybe it would have led her to be more watchful of the audience when she went into the school. It's difficult because that's a very emotionally charged scenario, but it's important to recognize the different things that are adding up throughout your day and the different stressors and when you need to take a break. So we talked about it earlier, why we don't prioritize self-care, and sometimes it's because we don't know we need to. So in this situation, Maggie didn't realize she needed to and just keeps rolling with it, just keeps rolling with the day. She got him to school on time. She's in survival mode. Then she has her presentation. She's unexpectedly observed in class and she keeps rolling with it. And then the crash comes where she has this, very upsetting information. Her child is hysterical and it leads to this outburst. And maybe she would have handled it differently or maybe not. But either way, it could have been beneficial for her personally to take a minute for herself. Now we have Craig. Craig is a pediatric optometrist. Craig lives with his mother who has Alzheimer's. He is her primary caretaker. Craig wishes to have been married at this time and starting a family of his own, but between work and caring for his mom, he struggles to find time for himself. This morning, Craig's mother appeared disoriented and begged Craig not to leave for work. Craig had to leave and left his mother with her health aide. While driving to work, Craig began to cry. When Craig arrived to work, he tried to refocus on his patients. Craig evaluated a new patient who is 10 years old. Craig learned that this patient's vision is deteriorating and that she will go blind within the next 5 years. Craig needed to share this information with the patient and her parents. Craig knew this would be a difficult conversation and he decided to immediately meet with the patient and her family to get the conversation over with. While Craig began to share the information, the parents had several questions and became quite emotional. Craig then burst into tears and needed to excuse himself from the conversation.
Oh, yeah.
Oh no. So, what do we think about this one?
This one, yeah, this one to me seems much more clear that, okay, taking some time between, the patient can wait an extra minute before you pick them up to like recenter yourself, focus, or that, you need to share this information with the patient and the parents, you know, even if you don't want to wait till say the next day, just, give it a few minutes, maybe think about first what you're going to say, how you're going to say it, so that it's a little more practice and it's hopefully not as emotional coming out. Um, but yeah, that
And
would be hard to be.
sometimes we're just having a terrible day and we're allowed to be human and we're allowed to lean on our colleagues and
Mhm.
say, I need your help. I have really difficult news to deliver to a parent, and I don't feel like I'm able to do it professionally today. Can you help me out? We're allowed to lean on each other. It's one thing if that's happening every day, but you have to check in with yourself. And if you know you're just feeling really fragile and there's a risk that you can communicate something unprofessionally, you need to check in with yourself and lean on the people that are there. I see we have a message.
Yeah.
I think we're afraid to take mental health days when we need them. Well, yeah, I think that's a common it's a common concern. And
Mm.
sometimes it is necessary. Sometimes our emotional health can have symptomology that's very similar to physical illness, whether it's stomach ache, headache, nausea, those could all be signs of anxiety and distress. So sometimes it's hard to differentiate if you're physically sick or if you're emotionally really worn out. So, you know, use your own discretion and make sure to take care of yourselves because it will pile up.
Mm. Yeah. No, I agree. And it's nice having, other people at SUNY to lean on, having those colleagues. I feel like it'd be very hard to be in, maybe a solo practice setting. And it's,
Yeah.
really has to fall on you. In addition, if you are the practice owner, that's already the pressure. But then if you're the only one seeing patients, then, you don't really have anybody else to rely on. So that becomes even more important in those instances.
And that's another stressor too.
Hmm. Hmm.
So, what are some of the things Craig and Maddie could have done to improve their self-care? Maybe morning meditation, starting their day off with some deep breaths, speaking to someone they trust, exercising, setting aside time for themselves. If they don't have it, scheduling it, asking for help when they need it, and recognize when they need to take a break. Maybe a support group, listening to music on the way to work, podcasts, reading a book at night, planning for difficult conversations like you shared, Dr. Leach, especially with situations like that. Mapping out and scripting the conversation in advance could be really helpful. Having a healthy diet, spending time outdoors, going for a walk, journal writing, daily check-ins with yourself, pausing to stop and think. How could self-care improve Maggie and Craig's life? Well, I think it would certainly help them reduce burnout, help them manage their stress, feel calmer, help model appropriate interactions for their children, for their patients, improve their job performance, find time for themselves, safeguard and protect their well-being, create balance in their lives, set healthy boundaries. It'll help them to manage multiple tasks at once. We all have so much on our plate, and if we don't take that time to pause and check in with ourselves, could really come to a head and become too much. We could only run on empty for so long. So
Hmm.
it's really important to take that time and find that time to take care of yourself. So now to our questions.
Oh, I don't guess anything yet. Um, there was something, let me see. Yeah, I find that like when some of these things start to pile up, it's just easy to get in a cycle that where it gets worse and worse in terms of like, I don't exercise, I don't eat as healthy that meal, and then it becomes easier to stay in that cycle of not doing something healthy or good for myself, if that
Right.
makes sense.
It's like, how do you break the habit? When you
Hmm.
have so many days in a row and you just can't get out of that funk, out of that cycle, it's really hard to pick a day and start fresh. So there's little strategies for creating new patterns. So if you want to start working out in the morning, you can at night pick out your workout clothes and your sneakers, have them, laid out so that right away you wake up and you see it right there. Making a social commitment. If you make a plan with someone, let's go to this workout class together. You're more likely to show up because of that social commitment that you both have plans to go. So
Hmm.
things like that can help you to follow through with an action plan,
Hmm.
scheduling it in, putting like a reminder in your phone. If it's get lunch, like look up local health. I mean, we're in New York City. There's a million
Mm,
really expensive and really healthy places right near us. Just to maybe once a week get a juice, add something healthy in your diet, go for a walk, especially with the weather getting nicer, and just
mhm,
listen to music, be present, trying to really slowly incorporate new daily habits into your everyday life. And that's how you start to get into a new rhythm. But it's hard once the work just keeps piling up, and then other responsibilities and the people you're caring for, their needs, are first and foremost in your mind. So it feels so secondary, or not even, or after secondary to even consider when you're going to make time for yourself.
mhm, absolutely. Mhm.
What breathing exercises would you recommend to someone who's having anxiety? So YouTube is a great place to explore if you're having anxiety, if you're feeling that heart racing, discomfort in your stomach, nausea, you can YouTube 5-minute guided breathing and have someone really just walk you through it so that it kind of takes control over the thoughts and helps guide you through that process rather than taking it on your own. Because sometimes when you're so stuck in your head and you're having a lot of anxiety, it's hard from the start to begin guided breathing or knowing how to do that independently. So once you master that skill, it could become more natural on your own, but it could be a great resource to look up any guided meditation, guided breathing, even, a short period of time can make such a difference. And if you don't have that accessible, really any slow and long deep breaths, go like breathing in through your nose for 5, holding for 8, and then exhaling for 5. Good question. And really important skill that you can use in any setting to kind of help calm yourself.
So, Dr. Velez, you raised your hand, but I can't. Should be away
Oh
from me.
no, that's
Here. Dr. Velez, did you mean to raise your hand?
No, sorry, I was trying to do a clap.
Oh,
I hit the wrong thing.
no worries. Thank you. All right. Maybe.
And if there's any questions that you think of after this webinar that come to you, or additional trainings you'd like to be facilitated, please don't hesitate to share any feedback or any topics with me. I'd be happy to put, if you wanted a presentation on guided breathing or stress management skills, I'd be happy to facilitate that.
I think particularly, I mean, I could benefit from stress management skills, but even like our students, like, I know particularly post-COVID, it's been difficult with finding a balance for them. And they have the option of, should I Zoom in? Should I go into class in person? And then they end up not listening in that moment. And when do I have time to listen to it later? And so I think I've noticed some of their time management skills, and then they get stressed and overwhelmed. And a lot of them do have family in the area that they have responsibilities to. So I think, some sort of, not class, but
Guidance or discussion about, because maybe they're in the same umbrella as at times not knowing that they need to take a break and not realizing that their self-care is suffering and that they can benefit from prioritizing that.
Mhm. And I think, we hear self-care and we're like, oh yeah, I need to, like you mentioned at the beginning, like we think it has to be some long thing that I need to take an hour out of my day to do. And so I think just
Getting
people
out of the building,
exactly.
calling a funny friend, someone who's always a breath of fresh air, checking in with your grandparents, something, anything. Having a cup of tea, just like going and getting, if you have a lot of anxiety, maybe no caffeine, decaf, and like going getting a caffeine-free drink or something to just change the scenery for a second. It could really just be a few moments. And yeah, it doesn't have to be a huge undertaking, and it could be transformative in your day.
Yeah, I agree. Anytime I do that, I come back with a renewed sense of like feeling like, okay, like I have a better idea of where I can start if I'm feeling overwhelmed versus
Yeah.
if I'm sitting there, I'm
You need to
stuck.
just walk away. Yeah.
Hmm. Anyone else? Any questions, comments? Do you have suggestions for support group, or like what kind of support groups do you mean in terms of like caregiving? There's specific caregiving support groups people can
If
join.
you're caring for someone, absolutely a caregiver support group to really connect with other people who are going through something similar can be such a powerful resource. Um, and really depends on your individual needs. We all have different struggles. Some people, have really difficult time managing their anxiety. Some people struggles are more severe. So dependent on what you're going through, there's so many different support groups that really are specific to your individual needs. So I find connecting with that sense of community can be really, really helpful in your healing process.
Yeah. I think that's helpful too, because I think of a lot of, I work with children with disabilities and their parents are very often seem overwhelmed in the exam. And like they come to the exam room thinking it's going to be their time to relax because they're, constantly on throughout the day. So then they're not really paying attention during the exam. They're not helping the child to focus and things like that. Um, so how would you suggest maybe broaching the topic with them of like, I know you're overwhelmed. Like I try to thank them for bringing them in and prioritizing their child's health, but like in what ways can I maybe broach the topic that, make sure you take time for yourself and yeah, I don't want you burning out.
No, it's so important. So any time I'm speaking with parents in similar situations, asking, how are you doing with all of this? It must be a lot.
Mhm.
And just having that human response and, just saying to them that this would be a lot for anyone and that there's tons of resources. And, if you need anything, we have a social worker here. We have people that we can connect you with because it is a lot and it's important to make sure that you're taking care of yourself too. 9 out of 10 times when you say, how are you handling all of this? They're going to respond, it's not easy.
Yeah.
They're going to respond and they're not going to say, piece of cake. It's really, I don't think I've ever got, oh, it's all really easy and good.
All
They're
right.
going to say, it's really hard. So I think you'll be pleasantly surprised with how open people are. I know sometimes it feels uncomfortable to ask that question and you don't know how it's going to be received.
Mhm.
But I very rarely receive reluctance or resistance. And I most frequently receive just honesty and just an open conversation because we're all human and you can't pretend it's easy, So people are receptive to help, people are open to these conversations. I would encourage you all to feel as comfortable as possible to ask them how they're doing, ask them if they need anything, tell them that there's resources here, tell them about me, that you could connect them and that they can talk more about what they're going through with me, and I could help find the individual resources that they might benefit from. If you don't have the answer, one of us will. So just knowing that they have a team behind them can be helpful within itself.
Well, yeah, it's certainly, I mean, you probably feel like you're underutilized. And I know that in our clinic, I'm like, oh, there's so many instances that I think back, I'm like, oh man, like I need to, remember to utilize the social work resources.
Yeah, don't hesitate.
All right. If there's no other questions, oh, we have a chat. Oh, thanks, Dr. Les. Um, believe that's everything. Is there anything else that you wanted to touch upon? That was great.
No, I think that is it. And like I said, I'm happy to facilitate different topics going forward.
Absolutely. Yeah, I think, as faculty members, I'll just speak about ourselves for a moment that, we have a lot of different responsibilities. It's not just seeing patients all day, every day. We have the students to worry about, the patients, staff. I had an incident between a staff and a student last week and working on that. And I came home and I was like, that was like the worst day I've had in a long time. So like I think as faculty members, something might be useful to just even just talking about it, even if you know what I mean. Like tonight, I
Definitely.
feel like so much more renewed of like, okay, even taking those small breaks is great. And so it doesn't take very much to
Yeah.
feel better.
No, it's really necessary. And those situations too, like you said, with a staff member and a student, that's really difficult. So speaking with someone too to kind of debrief and process it
Mhm.
is important too for managing your own stress as well.
Absolutely. All right. Well, thank you so much, Robyn. We really, really appreciate it. I will definitely forward you any questions that we may get, and we're going to set something up in the near future.
Wonderful. Thank you so much.